Fox Carolina is committed to you, and there is a lot of talk about monoclonal antibody treatment for people who test positive for COVID-19. But what is this treatment? Who can get it? Should you get it in place of the vaccine? We are going in depth to get you those answers.
And Carrie Weimer working to get those answers for us. She is live outside Oakview Medical Associates in Greenville. Carrie, you spoke with some medical professionals there as well as someone who has actually received this antibody treatment. What did you learn today?
Well, guys, monoclonal antibody infusion. Say that 3 times fast. It's an IV process that packs quite a punch to COVID-19, but it's not for everybody. We went to the medical professionals here to find out what it's all about.
I probably would have went in the hospital with knowing friends of mine. You know, I lost several neighbors to it, and so I knew what it was going to be like.
Mary Stone says after getting sick with COVID and getting a monoclonal antibody infusion, her health dramatically increased and kept her out of the hospital.
Within the next day, 24 hours, I still was coughing, but I didn't get the fatigue and bad. I didn't really have to stay in bed.
Dr. Bijor from Oakview Medical Associates says people that cannot get vaccinated or people that have chosen not to get the vaccine now have an option to get the infusion, but must do it within 10 days of getting infected with COVID-19.
With our technology and science, they have isolated the parts of the virus that our body reacts to and creates antibodies, and they've taken that little antibody and cloned it, I guess, millions of times.
She says the infusion of antibodies is experimental. It is not FDA approved, but provides another option to keep people from needing emergency medical care.
When you get an infection, your body has not been exposed to the virus, so you've not had a chance to develop your own antibodies like you would if you had had the vaccine. When you get the vaccine, your body gets enough time to mount your own response from within your own cells.
Both DHEC and healthcare professionals say this is not a replacement for the vaccine.
It's new relatively, so it is not something that suddenly can be available at retail clinics or pharmacies and things like that, because there are studies, there's a lot of data, there are a lot of people at the back end, you know, scientific people and researchers making sure that it's safe for general use.
We asked DHEC if there have been any adverse side effects from the treatment so far. They told us today they have not received reports of any.
Probably saved my life.
Now, DHEC told us today there are currently over 50 places statewide that you can get that infusion. 13 of those are right here in the upstate. But they told us inside you're going to need a doctor's order to be able to get one. Now, if you want to find a location near you, we've got all that information in our Fox Carolina News app. Cody, Tori?
All right, Carrie, thanks so much. We do want to break down who is actually eligible for getting these treatments. Carrie's been talking about this. Doctors say patients have to be over 12 years old. You have to weigh more than 88 pounds. You have to test positive for COVID-19, and you have to have an immune system issue there. It has to be compromised. And again, you have to be at a high risk for hospitalization, severe illness, or even death. So again, there are some things you have to qualify for, but it is something to look into if you do qualify.